I found you through, I was in a doctor office waiting room reading the Eugene magazine, and you were in there for one of the best dentists.
Okay.
Yes.
All right.
I found you, and then I made a phone call.
Perfect. So one of the interesting things that you put on your signs and symptom sheet is the feeling that you have a hand resting on your throat. So have you noticed that at all in the last several months, couple months?
No, I have not. Haven't noticed that.
Okay.
Before it was like almost like a gentle, almost kind of like a pushing feeling on my throat, but I have not noticed that
Okay.
in the past 2 months.
Good, good. What about the headaches and the temple, pain behind the eye kind of thing?
That's virtually gone. I very rarely have that. So, yeah, where when I first came here, I was having it multiple times a day.
Okay. And
Sometimes lasting for an hour to hour and a half, 2 hours at a time.
wow.
And then it would fade away for a little bit, then maybe come back later in the in the afternoon. Yeah.
Okay. And you had had an MRI done, and all of that came back clear.
Yes,
if I
it did.
remember.
It all came back clear.
Okay. And so, any issues with neck or sore muscles or shoulders?
No.
Okay.
No issues with that.
Now, but you
No
did
issues.
beforehand.
Before I did, yes.
Yeah, before. Okay. What about the vertigo and the dizziness? You still getting that?
No, I haven't had that for months, for many months. No vertigo, no dizziness.
Excellent. What about
before I would get it when I was turning, say driving in traffic, turning to look for traffic left and right, I would get it, but I haven't had it in many months. So.
Well, good, good. What about ear pain?
No ear pain.
Okay. Wow, it seems like you're having quite the response.
I am, yes.
Excellent. Are you happy you had it done?
I'm very happy I had it done.
Good.
Yes.
So we haven't been following you with a ton of post-op videos or even a first video, I think. But I just want to find out how many visits, because I think we saw you over 6 visits.
Yes, I believe so.
Okay. Yeah, you were a little bit of a more complex case.
Yes, I was.
Yeah. Usually this takes probably 3 or 4 months, but I try to go until we get it as stable as possible. I don't charge extra. I just, I want my patients feeling the best and to get the best out of the results that they can. Have you noticed anything else different since you've kind of gone through this procedure?
Yeah, actually I noticed that I can actually chew on both sides now. Before I would always favor one side, chewing my food, which I guess sometimes I didn't even realize that I was doing that. It just became a way of life, and now I can chew on both sides now without having the problem, without having the pain in my jaw or the ear pain.
That's a wonderful thing.
It is.
Yeah, and it's something that those of us that don't hurt really kind of take for granted, and we don't think about it.
Right.
But and it's interesting too. Once you start hurting, the body just does whatever it has to avoid the pain,
I
and
think
so
my body just adapted to just having to chew on one side only. Before. So.
well, good.
Yeah.
All right. Well, I thank you for allowing me to kind of share your story and testimony. There's quite a few people out there that are suffering horrendous pain, and this is not an option for everyone, but certainly it's an option worth pursuing, and if you're a candidate, it's certainly simple enough, painless enough to do.
Right. Totally
Okay.
painless.
Yeah, perfect.
Totally
Excellent.
painless. And totally worth it.
And totally worth it, okay. Well, thank you so much.
Yes.